Hey everybody, Dr. Rafich here from Vet Triage. We are going through this issue of veterinary surgery. It is going to be, let's see, where is, there we go, there it is. So this issue of veterinary surgery from February of 2022, and we're going to be talking about this journal article here, the significance of the meniscal flounce sign in canine stifle arthroscopy. I have not heard of this before, so this is pretty cool, and I'm excited to go through it with you. Here again are for folks who want to learn more about cranial cruciate and meniscal disease in my channel. Feel free to search these videos, and you'll see there's 4 parts to a comprehensive canine cruciate ligament disease series here that I have. All right. This study comes out of a specialty center in Yonkers, actually, where I was born. Another specialty center in Austin, Texas, the vet school in Texas A&M. The objective is to determine the diagnostic significance of the meniscal flounce sign in association with meniscal tears. It's a prospective cohort study, 130 stifles in 120 client-owned dogs that underwent stifle arthroscopy. Results found that 68.5% had a positive meniscal flounce sign. So just before we go any further, what I believe is the flounce sign is that waviness that you see there to the meniscus. So the absence of that tells you that there's a meniscal injury. The presence of a flounce sign tells you that it's a normal meniscus. So 68.5% had a positive meniscal flounce sign. Of these stifles, 4 had a meniscal tear, and they were all radial tears. A total of 41 stifles, or 31.5%, had a negative meniscal flounce. Of these stifles, 38 had a meniscal tear. Therefore, the sensitivity of the meniscal flounce sign to indicate an intact or torn meniscus was 96.6%. Specificity was 90.5%. Positive predictive value was 95.5%. Negative predictive value, 92.7%, and diagnostic accuracy was 94.6%. Conclusion, a positive meniscal flounce sign was associated with a normal meniscus, and the absence of a flounce sign is associated with meniscal tear. Just so you know, those numbers are very high. To have 90% or more of sensitivity, specificity, etc. is very, very high. Normally you'd have like a high specificity but a low sensitivity or whatever, some kind of balance. So these are really high, which tells me either this is a ridiculously accurate testing of meniscal tears, or that the study is flawed and that they don't have enough animals, which is typically the case. Introduction. The reported incidence of meniscal injuries ranges from 20% to 77% in dogs that also have a cranial cruciate ligament injury. Post-liminary meniscal tears following stifle stabilization are reported to be up to 37% of cases, depending on surgical technique. Injuries to the medial meniscus are known to contribute to persistent lameness and affect the long-term outcome and recovery of dogs with cranial cruciate ligament injuries. Accurate identification of meniscal pathology is therefore important. Arthroscopy is the gold standard for diagnosing medial meniscal injuries. In people, tight knees or poor portal placement, osteophytosis, or a certain inexperience can lead to only the free edge of the caudal pole of the meniscus being visualized. The meniscal flounce, which is a fold in the free, unanchored inner edge of the medial meniscus, is a common scope finding in people and dogs. Its presence is thought to relate to the anatomic configuration of fibers present in the meniscus that allow hoop stress to be exerted through weight bearing. External forces during scoping can also cause this fold to be present in the free margin of the meniscus. Disruption of the fibers or meniscal attachments can produce variation in or eliminate the fold or buckling appearance of the free margin. In people, the absence of flounce is a strong predictor of the presence of a medial meniscal tear. The meniscal flounce sign has been reported to be a normal finding in dogs. All right, materials and methods. This study occurred between February of 2018 and November 2020. They used a 1.9, a 2.4, 2.7, or a 4.0 millimeter 30 degree 4 oblique arthroscope with a video capture system, and everything else was pretty standard. Here's evidence of an absence of flounce sign. Now you would think that the evidence of a big splattering of blood would tell you there's a meniscal injury, but maybe the reason why they're not pointing that out is because you can see that with a cranial cruciate tear as well. But let's not forget the obvious stuff. Anyway, the edge of that meniscus, as you can see, is smooth. See, it doesn't have that rippling effect, that flounce sign. All right. Results: 74 left stifles and 56 right stifles. Most of these dogs were female, most of them spayed. Most common breed, pit bull mix. Most common purebred, Labrador. They weighed 31 kilograms and the age was 6.7 years. Meniscal flounce sign was positive in 68.5% of stifles. Normal menisci were noted in 85 of the 89 stifles. The meniscal flounce sign was negative in 41 stifles. Meniscal tears were noted in 38 of those 41. So a total of 42 stifles, or 32.3%, had meniscal tears. Bucket handle tears were most common at 73.8%. The remaining tears were either vertical, longitudinal, radial, or complex degenerative. Like we said before, sensitivity was 96.6%, specificity 90.5%, positive predictive value 95.5%, negative predictive value 92.7%, and diagnostic accuracy 94.6%. Discussion: the results demonstrate an association between a positive meniscal flounce sign and a normal meniscus, and between a negative meniscal flounce sign and meniscal pathology. When the flounce sign was noted, the meniscus was normal in 95.5% of cases. This indicated a low chance of finding a meniscal tear when the flounce sign is present. When the sign is absent, meniscal tear was found in 92.7%. Overall accuracy to identify meniscal tear, 94.6%, which is similar to findings in human knee arthroscopy. The absence of this sign was noted in menisci with all tear types except for radial tears. These results indicated the loss of the meniscal flounce sign is most consistent with the longitudinal, bucket handle, or complex degenerative tear of the meniscus. Visualization of this sign should not replace probing of the meniscus, but used in conjunction. Small radial tears of the caudal pole of the medial meniscus was noted in 4 stifles. All 4 stifles also had a positive flounce. This may be because small peripheral radial tears do not cause enough disruption of the meniscal fibers to eliminate the flounce sign. In people, the sign can be present in several different regions of the meniscus depending on the individual. Another study found that medial collateral ligament laxity can alter joint mechanics and the appearance of the sign. So limitations of the study was you need more dogs. Also, I would also argue that having an MRI as a secondary test. MRI is also minimally invasive, although it requires general anesthesia, but so does arthroscopy. MRI does not require any penetration into the stifle joint. So it may be that a good test to run by this as a secondary, confirmatory diagnostic in the same dogs that also get the scoping after the MRI would be to have an MRI done as well. But this is pretty cool. I haven't heard about this before. I think it's great. And especially for those stifles that are really arthritic, have a lot of periarticular scarring, they're just causing you issues. That's great to have at least a diagnostic, a fairly easy sign to look for this problem. So kudos, very cool study. All right, we'll see you guys tomorrow. Thanks for supporting the channel. Bye-bye.